Welcome to today's Explainer. Right now, we're decoding 16 cutting-edge cinematic models that literally show us how modern medical professionals are completely reimagining the future of healthcare. Seriously, it's a fascinating, deeply detailed look at exactly where the medical field is heading and, more importantly, how the practitioners themselves are viewing their evolving roles.
Okay, let's dive right into this. To make sense of all these models, we've gone ahead and synthesized this chaotic future of medicine into 5 neat pillars for our explainer today. We're going to start with a new medical paradigm, move into food, fitness, and prevention, explore the mind-body connection, take a look at compassion in specialized care, and wrap the whole thing up with the united medical front.
All right, kicking things off with Pillar 1, a new medical paradigm, the evolution of healthcare.
Across all the models we analyzed, there is just a massive philosophical shift in healthcare happening right before our eyes. Historically, the traditional approach to medicine was, well, kind of a tangled web, right? Super reactive, heavily bogged down in confusing jargon. But today, the paradigm is totally shifting toward preventative, whole-person care. Take a foot and ankle specialist, for example. Instead of hiding behind an impenetrable wall of Latin terms, they're sitting side by side with you, using simple diagrams to empower you with genuine understanding. It's a total game changer.
Which leads us directly into Pillar 2, food, fitness, and prevention, proactive health.
Prevention instead of treatment. This isn't just a catchy phrase anymore. It's literally becoming the new medical foundation. Internal medicine doctors are conceptually leaving the sterile clinic and heading straight out into the city park. They're out there championing active lifestyles right where real life actually happens.
And this proactive mindset is uniting entirely different disciplines, which is so cool to see. A urologist is now just as likely to discuss the nutritional value of your dinner as a cancer specialist is to research how your daily vegetable intake impacts oncology. They're presenting a united front, fundamentally agreeing that what you put into your body dictates your health long before a prescription pad is ever needed.
But hey, don't mistake this wellness focus for blind acceptance. Modern doctors definitely maintain a rigorous, healthy skepticism. Whether we're talking about the latest icy-cold plunge trend or grocery store shelves absolutely loaded with heavily marketed probiotic supplements, physicians are fully embracing wellness, sure, but they are demanding hard, clinical evidence before they buy into any internet hype. They're not just jumping on the bandwagon.
Let's move on to Pillar 3, the mind-body connection. Healing the brain.
Treating the physical body now inextricably means treating the mind. Mindfulness has officially moved from a fringe concept to absolutely center stage. We're seeing psychiatrists pairing traditional meditation spaces with cutting-edge, real-time brain mapping holograms. Mental health is finally being treated with the exact same high-tech clinical seriousness as, say, a broken bone or a failing heart. And fun fact here, studies show that actively visualizing these mental states can literally trigger structural neural changes. So the placebo effect, it isn't just all in your head, it is biologically measurable. How wild is that?
But, looking at all this high-tech care and serene mindfulness brings up a really stark, highly human reality. I want you to ask yourself a crucial question. What happens when the people caring for us are the ones who desperately need care themselves?
28. Just take a moment to let that number sink in. Stripped of all the glowing holograms and bright clinic lights, the foundation of our entire medical system often rests right on the shoulders of young, deeply exhausted resident doctors surviving 28-hour shifts in dim hospital hallways, kept alive by just a cup of coffee. It's a stark reminder of the immense human toll and physical exhaustion going on behind the scenes, especially when you consider that being awake for just 24 hours can impair your cognitive function as much as having a legally drunk blood alcohol level.
Shifting gears a bit, we enter Pillar 4, compassion in specialized care, humanizing the clinic.
Coming out of that harsh reality, what's really interesting is seeing how deep human compassion is entering even the most chaotic environments. Take time theory. This is an intense concept of how severe trauma actually alters a patient's psychological perception of time. Even in a fast-paced, high-stress ER, doctors are prioritizing these deep visual explanations using surreal time clock effects and transparent brain illustrations just to ensure patients truly grasp the complex reality of what their own brain is going through. And this compassion, it extends across the most highly specialized fields. A reconstructive plastic surgeon isn't just focused on tissue in the OR anymore. They're navigating incredibly nuanced emotional discussions about beauty standards alongside cleft lip planning. OBGYNs are prioritizing deeply supportive, caring conversations over quick checkups. Even anesthesiologists are boiling down complex pharmacology into simple, relatable pain management like Tylenol and ibuprofen. They are intentionally centering human connection in what are usually highly sterile spaces.
So, what does this all mean for you? What are your direct health takeaways? Number 1, stop rubbing your eyes. Ophthalmologists warn this is incredibly damaging, so just don't do it. Number 2, demand clarity. If you don't understand something, ask your doctor for simple diagrams, just like that foot and ankle specialist. And number 3, make the grocery store your first line of defense before you ever hit the pharmacy. Focus on that nutrition and prevention.
Bringing it all together, we arrive at Pillar 5, the United Medical Front, a collaborative future.
You see, modern medicine doesn't operate in a vacuum. Pediatricians, for example, are now subtly recognizing that massive global issues like climate change and environmental health are inextricably linked to the local, individual mental and physical health care of their young patients. We're seeing pediatric monitors subtly displaying climate change and mental health graphics side by side with vital signs.
So, the crucial point here is that despite the exhausting shifts and despite the intense ER environments and all the skepticism, the cinematic vision of healthcare's future actually ends on a profoundly inspiring note. It relies on a diverse, confident collaboration where multiple specialties, from nutrition to neurology, stand united rather than working in isolated silos.
As we wrap up this explainer, I really want to leave you with a provocative thought to chew on. As we transition from reactive treatments to holistic care, from just throwing pills at a disease to embracing nutrition, mental health, and genuine human connection, are we finally moving past simply treating symptoms to truly treating the human being? Think about how you approach your own health and how you're going to interact with the medical professionals in your life moving forward. Thank you so much for exploring this with me today, and keep asking those big questions.